Hey guys, it's your girl Betha and I'm back again with another video. Okay, so I would say this is our second official video, right? Yes, official video. Today I'm going to start my projects. So today we are going to talk about the kidney. So when we say the kidney, what is the kidney? The kidney is one of the vital organs in the body. Actually, we have 4 vital organs in the body: the kidney, the liver, the heart, and the lungs. So when we say the kidney, what is the kidney? Okay, so the kidney is a very vital organ in the body that helps excrete metabolic waste substances. Okay, so I think this is something we all know, we learned it in school. Okay, so before I continue, I'm going to tell you what I know so far from my experience and everything that I know. And if there's anything I didn't mention that you know of, you can drop them in the comment section, okay, so that we can help educate each other. Okay, thank you. So what are the functions of the kidney? Why is it so important to us? So first of all, the kidney excretes metabolic waste substance, like the things you take into your body, like the food and other substances you take into your body. It excretes the waste. After your body takes the important parts of the food you've taken in, the rest comes out. The waste comes out as urine. That's what the kidney does. Okay, so the second function is that it regulates our blood pressure. When I say regulates our blood pressure, as it normalizes your blood pressure. Yes, when you have very healthy kidneys, the kidneys helps to normalize blood pressure. Also, the kidney produces the red blood cells that helps in the formation of blood. Yes, blood. Yeah, you know everybody needs blood. When you go to the hospital, they tell you to go and check your blood level, your hemoglobin level. Yes, the kidney helps to, unyamuja, like you get blood. You get me? Yes. That's what I remember for now. So the next thing I'll talk about is signs of kidney failure. Like the next thing I'll talk about is kidney failure. So what is kidney failure? Kidney failure is like when your kidneys are not functioning properly, or they are not functioning at all. They are not doing their work, like their works, like the functions I'm mentioning. Your kidneys are not able to perform those functions. So first of all, we have types of kidney failure. We have the chronic and we have the acute. The chronic is like, when we say something is chronic, it's like it's very serious, like very serious. And then acute is like like it's good but not that good. It's not that good, but at least you prefer that to the chronic. Let me put it like that. The acute is reversible. When I say reversible, it can be fixed. It can come back to its normal state. Yes. And the chronic is irreversible. In very rare cases, people get their kidneys working again when they've been diagnosed with a chronic one. Yes. So in this section, I'll delve deeper into the chronic one. But before that, how would you know if you are having a kidney problem? Like, what are the signs? What will show? Like, they're just there. What is going to happen to you for you to see that? This one is about kidney. Okay, so first of all, from my experience, like I said earlier, I'm going to see everything from my experience. So from my experience, first of all, you're going to be getting puffy eyes. When I say puffy eyes, your eyes are going to be getting swollen around your eyes, especially when you wake up early in the morning. Yes. So the second thing is you're going to be getting swollen feet. Like your feet are going to get bigger. The third thing is your BP is going to be very high. You're going to get hypertensive. The figures are going to be really high. And also frequent urine, especially at night. Frequent urine, like when you pee, the next minute you feel like peeing again. The next minute you feel like peeing again. That's it. And when you pee, you are going to see that your urine has changed. It's foamy, like very foamy. When I say foamy, you get me, as in when you add soap to water, how it looks like. Yes, that's how your urine is going to look like. Yeah. So these are the signs that I got. So what next? When you see these signs, what's next? So from my experience, I would advise that immediately you see these signs, you don't wait. You don't just brush it. You don't just like, oh, it's normal. That thing, we like doing it, especially Ghanaians. Yeah, you don't just brush it off like that. You have to seek medical attention immediately. Immediately seek medical attention. So from my part of the story, I informed my mom about the changes I've seen, and then she advised that we see our doctor. So we went to see her, and then you see, she is a medical practitioner, so she, from the things we told her, she advised us to go and have a kidney test. So the test came out, and then it came out positive that my kidneys had failed. So the next thing she did was to firstly, she prescribed a BP drug for me to take to normalize my BP because the figures were too high. And then she gave us a referral letter to Kologo Teaching Hospital. Like I said in my previous video, that is where I go for my sessions, my dialysis sessions. Okay, I didn't mention that. So yes, I am on dialysis currently, so that is where I go for my dialysis sessions. She referred me there, and then I went there, and then that is where my treatment and everything all started. Yeah, so when I went there, I was asked to redo my test. They wrote a request for me to redo my test, and then when I redid it, the results came out the same. So my results were that I had an end-stage kidney disease, chronic, kidney disease. And so let me just fit this in. And the kidney disease of failure, we have 5 stages: stage 1, stage 2, stage 3, stage 4, stage 5. Stage 5 is the end stage. So mine was the end stage, like the end stage. The end stage, yes. And so I went through counseling, and then I was told about 2 options, which is the transplant and the dialysis. And so for immediate treatment, I was advised to have dialysis for immediate treatment. Yes, but then firstly I was asked if I wanted to have the dialysis. It was a choice. They would have to ask you. I think it's a professional thing. Yeah, I don't know that. I think so. They asked me, and I said, of course, I will do it. So yes, the first thing that they did before I could start my treatment was to pass a neckline. It's called the catheter. I don't know if you guys can see my neck. This mark is due to the second one, but I'll tell you about that in another video. So as you can see my neck, I don't know, let me get closer. There is something going on over here. You see, if you check here, there is nothing there, but if you check here, there is something going on over here. And then I have this here, called a permanent catheter or a neckline. So we have the 2 types. We have the temporal one, and we have the permanent one. The temporal one is fixed on your thigh, your femoral, if I'm right. Yes, so that is what they do first before they do this. So I had that one first. That one is called temporal because it can easily be taken off. It's like, I don't know if people know this IV line. When you go to the hospital, they pass something to your vein, and then they give you a drip. Yeah, it's like, the tip of it is just like that. How they fix it, if I'm right, because I didn't see it myself, but when they were taking it out, it looked like that. So that's why I'm saying that. So that's how it looks like. It's temporal, and it can easily be taken off. But with this one, is inside your skin, like it's inside your skin, and it takes time to take it out. So that's why that one is the temporal, and this one is so we use both the temporal and the permanent. It's used as an access to your blood vessel or vein, I don't know, so that you are able to have your dialysis session. Okay, so too soon we are coming to the end of the video. This is it for today. Watch out for my next video. My next video, we are going to talk about the other access that is used for the dialysis, and also the complications that come with the catheter and then the other access, which is called fistula. I'm just giving you a hint, by the way. All right, it was nice meeting you today too. Stay tuned for another video. Bye.